An act relative to substance use, treatment, education, and prevention by Kristen Bunten. My thesis is nurses need to become knowledgeable about the SBIRT process. Nurses are in a prime position to address patient substance misuse by using the SBIRT process. There are 3 learning objectives. The first is to understand the SBIRT process. The second is to understand the legislation called an Act Relative to Substance Use, Treatment, Education, and Prevention. And the final objective is to discuss nursing's opportunity to affect change in the opiate crisis by using SBIRT. What is SBIRT? SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. The goal of screening is to determine which patients require further interaction around unhealthy substance use. The use of a validated question or screening tool makes the screening more standardized, removes judgment, and helps the service to feel like part of routine care. Brief intervention is a short conversation that explores the patient's motivation to change. The goal is to elicit change talk from the patient and build motivation to take action with those changes. If a patient is interested in exploring substance abuse treatment options and they are referred out to clinicians who specialize in substance misuse disorders. Massachusetts State Senator Jennifer Flanagan sponsored Senate Bill number 284, an act relative to preventing adolescent substance abuse. Senator Jennifer Flanagan has a history of working closely with the school nurses in the state of Massachusetts and with the Massachusetts School Nurse Association in working on legislation regarding the health of children and as an advocate for the work of school nurses across the state. Like many states, Massachusetts was and is currently still experiencing an epidemic of opiate addiction. Governor Charlie Baker signed this act into law. This legislation was the efforts of the Baker administration and legislative leaders to prioritize addiction and to educate students about the dangers of substance misuse. When passed into law, this became part of Massachusetts General Law, Chapter 71, Section 97. The summary of the legislation is as follows. Each school district is required to develop and file with the Department of Elementary and Secondary Education a policy regarding substance use prevention and the education of its students about the dangers of substance abuse. Screenings are expected to take place annually at 2 different grade levels that are recommended by both DESE, the Department of Education, in consultation with the Department of Public Health. Typically, these grades are 1 grade at the high school and 1 grade at the middle school, with 7th grade and 10th grade being popular choices. Schools must notify students, parent guardians about the screenings in advance, and a student or the student's parent guardian may opt out of the screening by written notification at any time prior to or during the screening. The school must use a valid screening tool. Schools may not make a record of any statement, response, or disclosure by a student during the verbal screening process. No identifiers can be kept regarding the students. Except in cases of immediate medical emergency, schools must keep confidential any student responses to the verbal screening and may not disclose any information obtained in the screening to any other person without the prior written consent of the student, parent, and guardian. This includes not releasing information to the parents. Staff must attend an approved training program in order to administer the screening tool and follow this process. Nursing is in a unique position to affect change in substance misuse by using SBIRT, both in schools and other clinical practices. The Comprehensive Addiction and Recovery Act, also referred to as CARA, C-A-R-A, was signed into law by President Obama in 2016. There are provisions enacted by CARA that can be implemented in nursing practice settings. One provision is the expansion of a substance use prevention and educational efforts, particularly aimed at teens, parents, and aging populations, in order to prevent the abuse of opiates and heroin and other substances, and to promote treatment and recovery. In a Baclazac article entitled "Implementing Substance Use Screenings, a Prerogative for Nurses," it is cited that only 1 in 6 adults talk with a health professional about their drinking habits. Nurses are ideally suited to provide these brief motivational conversations in a variety of healthcare settings. Most of those who drink above low risk level do not have a serious alcohol use disorder that is likely to require treatment. But a brief conversation with a health professional to provide feedback about alcohol and health is known to help patients decrease alcohol use. Nurses are ideally suited to provide these brief motivational conversations in a variety of healthcare settings. Healthcare providers need to integrate screening and brief intervention into clinical practice based on the effectiveness of brief, targeted behavioral intervention in clinical settings. Here are the pros and cons of the legislation in Massachusetts. Pros include that we are attempting to address the opiate crisis, that we are increasing our education with students at certain grade levels through this process, that there is funding from the state level that has provided free training in the use of the screening tool itself. Most commonly used is the CRAFT tool. Another pro is that this provides one-on-one interactions with students with the use of a screening tool and a motivational interviewing, which is a change from a lecture format or a classroom setting lesson. And another positive experience, as reported by staff involved in the process, is that they find they are having positive interactions with students. However, there are several cons, and this will conclude the presentation with some of these cons. Data is still unclear that this will actually reduce substance misuse long-term with the current group of adolescents and teenagers. The process actually does not currently address vaping. Vaping is not included in the tool most commonly used across the state. Although training is provided by funding, there is no funding to assist with the extra staffing required to complete the process. As this process is being largely covered by school nurses and sometimes the use of guidance counselors, it can shut down a nurse's office or require multiple nurses or additional guidance counselors in order to effectively screen classes that are 200, 300, and 400 students. And then finally, motivational interviewing does take specific training and also takes practice, and that there is limited time and limited financial resources to give staff the ability to train effectively in motivational interviewing. Thank you.